Hello, I'm Dr. Christopher Herrington of Herrington Family Chiropractic. I want to make this a quick little public service announcement about diagnoses and seeking treatment. I have heard from a couple patients lately, and I hope this isn't a trend, but it seems to be coming up a couple times more often than it should, of patients that are coming in saying, oh, I had an ache or a pain, so I went to a massage therapist and they said I have blank. Or I have this pain and I went to my personal trainer and they did some soft tissue and it's better now. That's good that it's better, but they're not allowed to do that. I do work with some physical therapists and they have the same restrictions I do personally of we are only allowed to make a diagnosis from the musculoskeletal system. In New York State, chiropractors have the most restricted scope of practice. Other states have a much wider scope where they're allowed to make other diagnoses, but in New York State, we're only allowed to make certain ones. If you have a massive glandular problem, I can identify that, but I am not allowed to tell somebody, hey, you definitively have diabetes. I have to send them to an MD who does all the blood work, and they can give the diagnoses. I can alert the MD and give the referral to say, hey, I think this patient has this, but I can't say to a patient, you have diabetes. I can say you have a disc herniation, I can say you have radiculopathy, poor postural problems, sprains, strains, a whole bunch of things relating to the spine, but I can't give a diagnosis beyond that. So it's kind of odd that I've been hearing that like massage therapists and personal trainers have been diagnosing conditions. They have never had a clinical class, they don't get them in their curriculum, so they're not allowed to do that. And that's kind of concerning because that's a really, really important point to make to distinguish whether it's a soft tissue problem, whether it's a nerve problem, whether it's a much worse like cancerous kind of problem or metastatic problem. It's very, very complicated to differentiate all that, which is why doctors go through such a long amount of training to learn how to do that and be non-biased when they're making these diagnoses. The other thing is I see a lot of people getting very particular treatments from other practitioners that they're not really allowed to do. Again, as a chiropractor, if you come in and say, I have diabetes, and I say, oh, I can fix that, or I can help that. No, I can't. There's no studies that show that. Just like a physical therapist can't say, oh, well, I can help you with that broken bone. They might be able to help the tissue around it, but they can't help that actual tissue. They can't fix the broken bone. Your body can heal it. They might be able to help the muscles in the area that can heal it, but you really need to see an orthopedist. They're the ones who can help you with that kind of problem. There's a couple massage therapists and personal trainers out there that have been treating things, and it's not within their scope of practice, which makes it inherently dangerous for a patient. Not saying that they're doing a bad job, just saying that they shouldn't be. So and don't report, if you see doing something dramatically wrong, like a personal trainer physically adjusting somebody like a chiropractor would, you might want to mention that to somebody. That is dangerous. It is a medical procedure that they are not trained for, or a chiropractic procedure that they are not trained to do. Not at all. They are not allowed to do that. Physical therapists get some training in that. Doctors of osteopathy or DOs get training in that. Chiropractors get training in that. Nobody else gets training in that. So unless they have some kind of post certification in something, like personal trainers, there's a lot of personal trainers now that are called hybrid trainers, which is really kind of cool because they are personal trainers and massage therapists, or personal trainers and physical therapists. They can kind of mix and match what they're doing, working under different scopes of practice. That's awesome. I love seeing that because that means they can help a lot of people individually. But it is not good to have just a standard licensed practitioner doing something outside of their scope. It means that they are doing something that they've seen done and they're trying to reproduce it, not something that they know how to do. I personally have had a couple massage therapists come in that I've been seeing off and on business-wise. And they're like, oh yeah, well, the other day I tried adjusting somebody. I'm like, no, stop doing that. Do not ever do that. It took 7 years for me to learn how to adjust somebody. You can't do it just because I make it look easy. I'm just that good at doing it that I make it look easy. So healthcare is best when everybody stays in their lane. If I need any kind of MD level work that I have knowledge in, I send out to the MD. I might have knowledge in it, but I don't have experience in it. Two totally different things. Send out to the professional, let them take care of it, and have them follow up with me. Give me the actual information I need to know. If it's a personal trainer, they are not by scope allowed to do anything that they're really touching a person for. They can help you with exercises, but they can't actually treat any soft tissue. They can't do massage. They can do light stretching, like after a workout they can help you stretch a little. That's really about it. They shouldn't be doing any advanced release kind of techniques, any pin and stretch or any aggressive muscular work. Massage therapists can do that, but again, neither of those are allowed to treat a condition. They have to get a referral from somebody for the condition with it already diagnosed before they can treat it. Treatment and diagnosis is a doctoral level procedure, and no one else should really be doing it. So for any patients out there, just be aware that there are a lot of people that may be overstepping their bounds. You don't necessarily need to report them to state boards, but just be sure that if you see some kind of thing happening, maybe just pull that person aside on a very personal level and be like, hey, listen, I saw you doing this. Unless you're certified in it, you should probably not do that. And then, if you yourself need something, seek the appropriate level of care. If you have a joint problem or something that's been nagging you for a while and you don't know what it is, don't ask somebody who doesn't have any clinical knowledge. Don't ask a personal trainer. Don't ask a massage therapist. Go to slightly further up the ladder. If you're just a little sore, say you're sitting at work and you have generally poor posture, your shoulders start to ache. It's not really, you don't need a diagnosis for that. You know where it came from. You can see a massage therapist and say, hey, my shoulder's bothering me, it's a little achy. That's fine. Now if the massage therapist says, oh, well, you strained your shoulders, they're not allowed to say that. They can't give a diagnosis. So it's really kind of complicated, really kind of odd, but in the same thing, just don't seek information from people who aren't allowed to have that level of information. They haven't had that level of expertise. And it's just a quick note. If you have any questions, comment down below or email me. All the information's on my website, buffalodc.com, as well as on Facebook, Buffalo Family Chiropractor, or Herrington Family Chiropractic on Facebook. All right, that's all for now. Hope you have a great day.